We're going to be talking about some new therapies today surrounding NAD, peptides, and hormones. So I'm going to ask Dr. Zan first, what's NAD?
So NAD is a base molecule for energy production in all of our cells. So when we take it, especially through IV route, we're able to increase that concentration quite a bit because we don't have to worry about it getting absorbed through the intestinal tract or as a patch through the skin. We're able to get it right into the bloodstream. And when we get it into the bloodstream, we're able to take it into all of our cells throughout the system. And the cells that need it the most are going to take it up in the highest concentration to some extent. We have a variety of different preparations for NAD that we can utilize, not only through different concentrations, but also with different amino acids in order to kind of facilitate its transportation more towards the nervous system versus the rest of the system.
Got it. So yeah, I think NAD is a good one to have, especially if you're experiencing any neurological disruption. So a lot of addicts have a lot of neurological symptoms that they experience that can cause them dysfunction in their daily lives. So people that are addicted to benzodiazepines, people that are addicted to heroin or recreational drugs, this therapy is really good for. And optimizing health is also another good one. I'm receiving NAD at 400 milligrams once a week, and my neurological function is drastically improved. Limitless pill-like, it decreases how much sympathetic state you're really in. So if you get anxious or anxiety or you're just fearful of a lot of things, it kind of dampens that mood down a bit. So Dr. Zan, explain that process a little bit of why it moves you more into a parasympathetic or a sympathetic state into a parasympathetic state.
So for patients that are coming off of specific pharmaceuticals or recreational drugs and they're trying to kind of detox their system, the NAD is able to target specific neurotransmitters depending on what concentration we're putting it in. So specifically, if we're trying to get off an SSRI, for example, and you're having lots of anxiety coming off of it, we'll hit that neurotransmitter with a specific dose of NAD in order to reset that neurotransmitter and decrease a lot of that anxiety, bring you back to a normal state for you for that particular neurotransmitter.
Got it. So big benefits. NAD is going to be great for optimizing your health and neurological function. It improves mitochondrial health as well, and a lot of neurological disorders or addictions, so such as heroin, benzodiazepines, volume, cocaine, methamphetamines, is great for. Shooting into peptides. What are peptides? What do they do? And what are the top 3 best peptides?
So peptides are amino acid sequences that you can take through a compounded form. So a pharmacy will basically make a analogous form to what the body already makes. So there are many different types of peptides, and they can be taken either in injectable form or oral capsules. And different ones have different targets that we're trying to hit with it. So some of the top ones, for example, are BPC 157. That is a peptide that you can take orally or as an injectable. When we take it orally, it really helps to rebuild and recover the intestinal tract. So we use it a lot for people with reflux, with a lot of neuroinflammatory disorders going on in the intestinal tract.
Colitis, yeah.
Exactly. We can take it as an injectable as well. That tends to help a little bit more with soft tissue recovery and sleep, depth of sleep. There are specific peptides that we can utilize to enhance immune function, which specifically stimulate the thymus to create more T cells, B cells, natural killer cells. So we have thymosin alpha and thymosin beta that can be utilized through injectable form to increase some of our immune system function, which is very important for chronic viral infections, chronic bacterial infections, fungal infections. When the immune system is in an immune suppressed state, we want to be able to support its function and bring it up a little bit more. And that's an easy way to stimulate the body to be able to achieve that goal.
What about during pandemics?
So during a pandemic like this, in order to increase some of our immune system function, thymosin beta, for example, does increase some of our B cell function, which can be useful if that's deficient. Thymosin alpha can increase some of our T cell function, natural killer cell function, if that's deficient. And we can do laboratory testing in order to test objectively if that function is low or suboptimal. We can do blood testing through LabCorp Quest and see all of our T cell function, B cell function, natural killer cells, and be able to see if we can support those particular pathways in any deficient patient.
Yeah, it's interesting with peptides. Synergistic effects of actually BPC-157. Simple terms for that term is just an anti-inflammatory protein sequence. Actually, thymosin beta or TB500 will actually amplify the effects of BPC-157's anti-inflammatory effects by 4x, so 4 times. So really interesting of synergistic effects of peptides when used at specific dosages. Consult us at LIVV to really understand that. CJC ipamorelin is a big one to increase your pituitary's function of stimulating more somatotropes in the body, which is growth hormone. So it's your natural endogenous production of growth hormone, and that one's a really good way to increase growth hormone. So those are some basic ones that we have now. There's a plethora of peptides out there, weight loss peptides. There's actually melanotan that actually can make you tan. So if you're looking for a tan, don't want sun damage, UV damage, melanotan. So definitely contact us for more information there. Shooting into hormones. Give me a Cliff Note version of why someone would want hormones and how does that optimize your health.
Okay, so keeping the hormones optimal regardless of your stage of life is incredibly important for physiological function, for neurological function to be optimized. As we age, our hormones start to decrease after about 30, 35 years old. And as we get that decrease, we start to see an increase in chronic inflammation, bone loss, muscle atrophy, neurological dysfunction. So by keeping our hormones optimal, we can avoid a lot of these symptoms and keep ourselves in optimal health going into our 50s, 60s, 70s, 80s. Without having that kind of neurodegeneration, without having bone loss leading to osteopenia, osteoporosis, having muscle atrophy, and feeling like you can kind of live your optimal life with some of these hormones back in place.
Yeah, so what are some of those hormones? Let's go quickly for a male versus a female. How would you optimize that?
Generally speaking, men are usually looking to optimize testosterone levels because testosterone starts to drop off after 30 years old. So there's a variety of strategies we have for addressing that. We have direct testosterone supplementation we can do alongside some of the precursors we could increase, like DHEA or pregnenolone, depending on where the testosterone level is at for the patient. In addition to that, we need to modulate other downstream hormones like estrogens. So as we increase testosterone, sometimes we're also indirectly increasing estrogen. We want to make sure we're not doing that. So we have a couple of different strategies we can use to decrease that conversion pathway. For women, generally speaking, we want to keep estrogen levels elevated and progesterone levels elevated, or make sure that those two are balanced if one is higher than the other. So we can do either direct estrogen or progesterone supplementation in those cases, or we can signal the brain to increase stimulation to increase estrogen, progesterone indirectly, or give precursors with DHEA and pregnenolone as well in that context in order to help optimize those levels. We know estrogen has enormous effects on bone density. It has enormous effects on immune system regulation, so it's incredibly important to keep that optimized. Progesterone levels have a lot to do with inflammation in the brain, as well as depth of sleep. We know testosterone has a great deal to do with muscle density, motivation and drive. So a lot of these things are extremely important as we go on and our natural production starts to drop off. Make sure that everything is optimized.
Sounds really complicated. He's smart. So definitely go check out his page. Optimizing hormones is super important in any male or female. As you age, Dr. Zan actually taught me, it's just like when women go through menopause, biologically, they're not able to reproduce and actually procreate. So age definitely dramatically affects them over time, right? So for males, the same thing. At 30, you're going to be at your peak biologically, and then it declines over time. So, average lifespan is increasing with modern day technology, but with hormones now and peptides and all the new advances, you can live longer, have more longevity, and actually live a better life over time. And you don't really have to feel old or look old, because when I heard a lot of what Dr. Zan was saying, it was just, I don't want osteoporosis or osteopenia or muscle loss or muscle atrophy. So those are some types of things that if you are experiencing those, definitely contact your doctor and learn more about it.